Time now for Money Monday. Today we're talking about Obamacare and trying to make sense out of all the Affordable Health Care Act.
Yeah, joining us as always, the President and CEO of Great Lakes Credit Union. That's David Seeger. Morning, David.
Good morning.
How are the markets starting out?
Okay, they're very jittery this morning. These numbers and lines are pointing the wrong direction. We're in the red here, and the opening bell looks like we're going to be down. And Europe was down, and so was Asia. So
no surprise, really.
No, not at all. The jitters about what's going on with the government and what they're going to do or not do.
Makes sense.
All right, it does. Affordable Care Act, Obamacare, one of the same. Okay, a lot of things to it. Let's hit some of the highlights of it, though. Number one, all citizens and resident aliens must have coverage in place by 1/1/2014. That's the rules of the land. There are no exemptions. There are no exclusions for pre-existing conditions. So if you have a pre-existing condition, not an issue anymore. And if you have health insurance already, you don't have to do anything because you're already covered. You can pick your own doctor under the plan as long as the insurance company that you pick has that doctor
coverage
listed. So you're all set with that. Children can stay on their parents' plan until age 26. People under the age of 30, they can just buy a catastrophic plan. They don't have to have the full coverage until after 30. So that's one option for them. So it's a little bit cheaper if they choose to do so. And depending upon your income and your family, you may get a subsidy to help you pay for the health insurance that you're required to buy on 1/1/2014. And there are no lifetime limits on medical expenses. It used to be like $1 million. Now that cap has been raised. Wow. And also, if you become sick, you can't lose your coverage because you've become sick, and therefore they won't insure you anymore. So they have to keep you on, even though you may become ill, and you can't get your insurance canceled. Right now, that can happen.
That can
and does happen.
Exactly.
So those are some of the highlights of the plan itself. Okay, what does the plan have to cover? Well, certain things that the plan has to cover. Ambulatory services, prescription drugs, emergency care, mental health care services, hospitalization, rehab services, preventive and wellness services, laboratory services, pediatric care, and maternity and newborn care. Has to have all those as part of the plan as by law then. So now what type of plans can you have? Well, there's a bronze plan, there is a silver plan, a gold, and a platinum plan. The bronze plan is 60/40, the silver plan is a 70/30 plan, the gold plan is 80/20, which is very similar to what you might have now if you work someplace. That's typically what they would have. And the platinum is the big one in terms of the most best type of plan you can have. So you can choose whichever you wanted to do. From there and pick out the best plan that would meet your needs.
Great. It sounds like there's a lot of options.
Tremendous stuff here.
A lot of stuff that people need to do their own research on as well.
We only scratch the surface.
To be educated. Yeah. Okay. Thanks, David. Appreciate it. Time now.